My name is Israel Maurat, and I'm going to talk about cholesterol embolization after transcatheter aortic valve replacement. Definition: cholesterol crystal embolization is a rare disorder that results from the breakthrough into the bloodstream of the cholesterol-rich matrix of an atheroma plaque. Cholesterol crystals lodge in small caliber arterioles causing obstruction and generating an inflammatory response with consequent ischemic damage to the affected tissues. The clinical manifestations are multiple depending on the organ involved. It occurs in people with atheromatous disease of spontaneous for after the realization of vascular manipulations, angiographic, angioplasty procedures, cardiovascular surgery, or more rarely with the treatment with oral anticoagulants and after thrombolytic therapy.
Welcome to theangiologist.com. A patient comes in with toes that are blue on all 10 toes. What is going on? First question, is it painful? If the answer is no, and the blue discoloration tends to improve when the feet are warm or elevated, this is not a serious problem and likely unrelated to any vascular etiology. All they need is warmth to the feet and reassurance. If it's painful and it's involving all 10 toes, look for other clues. Livido on the prepatellar skin, blotchy purple discoloration on the plantar aspects of the feet and the lateral aspects of the toes. In that situation, you have to consider a vascular etiology, particularly if it's painful. So, feel the pulses. If there are normal pulses in the feet with painful discoloration of the toes and livido, think about atheromatous embolization. That is, particulate matter embolization from a proximal source. If it's both feet, you have to think about a central cause, like an abdominal aortic aneurysm, an ulcerated aortoiliac plaque, or even a descending thoracic aortic atheroma that's mobile. If it's only one leg, then you would think about a unilateral cause, like a popliteal artery aneurysm, or atherosclerosis limited to the common femoral artery bifurcation. That's theangiologist.com.
Application in medicine. At present, a large number of cardiac valve replacements for prostheses are performed each year due to valve disease, in order to influence their natural evolutions, improving prognosis and quality of life despite its usefulness in patients with valvular heart disease. It is known that they can lead to serious and even fatal complications, among which are thrombosis of the prosthesis, systemic embolizations, bleeding due to the need for anticoagulations, structural attenuation of the prosthesis insufficiency or valvular stenosis. Pros and cons. Pros. The main benefit of mechanical bubble prostheses is that they are made of a highly durable materials, so there is no structural deterioration. Cons. Patients with heterographic type bioprosthesis have a great tendency to embolize during the first 3 months after replacement. In patients with mechanical prosthesis, the insights of severe embolization leads to persistent neurological deficits or death.
The new development of percutaneous valve implantation, which is commonly known as TAVI procedure or TAVR procedure. What is this new procedure? In this, we replace the valve of the heart, which is known as the aortic valve, without surgery, without any anesthesia, and without any cut on the body. Any patient who has been diagnosed as severe aortic stenosis, which means severe blockage of the heart valve, which is known as the aortic valve, and is above the age of 70 years, or is not accepted by the surgeons. When the surgeons say that it is a very high risk for surgery or cannot be done by surgery, then we do these patients. The benefit of this treatment is that the risk of replacing the valve goes down. The patients do not have to recover for long period of time, and the recovery period is very short. There is no involvement of any blood transfusion during the procedure or after the procedure, and usually the stay is about 3 to 5 days in the hospital, and after the patient can walk around and go back to even work or to the family within 5 to 7 days time. And we have done the largest number of TAVI procedures in India, including all kind of valves and all kind of patients, extreme old patients and also some young patients where surgery was not possible. In these patients we have done this, and our team is fully geared up and fully trained to take care of such patients. And this is why we call it as one of the most experienced heart team in the country.
Issues applied in Ecuador. Aortic stenosis is one of the common cardiac degenerative valvular disease, with a prevalence of 1.3% in patients between 65 and 74 years and 2.8 to 4.6% in patients more than 75 years of age. In conclusion, the implantation of bubble prosthesis is not without complications, in addition to requiring anticoagulation which in turn can generate significant problems. Prosthetic thrombosis is possible due to temporary suspensions of anticoagulation as well as very secondary bleeding. Even bleeding with therapeutic anticoagulation bubbles may occur. Thanks.